Hello and welcome, very warm welcome to all of you. Good evening, everybody. I'm Sayuka from Radiance with You YouTube channel, and I hope all of you are keeping good health. Today, we are discussing a very important topic, especially for parents growing up with allergies. Long term strategies for parents. Now, allergies in children are becoming more common today, whether it's food allergy, dust allergy, pollen sensitivity, or skin related allergic reactions. As parent, it can be challenging to understand what triggers these allergies and how to manage them effectively as your child grows. With the right approach and long term strategy, parents can help their children lead healthy, active, and confident lives. We are not just here to talk about the problem, we are here to talk about solutions. Today, we will understand how allergies develop and what early signs to look for, and the most effective long term management strategies. So, let's connect today with our expert, Dr. Rahul Gulaganji, a leading ENT specialist from Vijayapur. Dr. Rahul Gulaganji is an MBBS, MS ENT, and HNS consultant, ENT head, and neck surgeon. He is currently practicing at Swara ENT Clinic and BLDE Hospital, Vijayapur. So, throughout his career, Dr. Rahul has contributed immensely to helping children with allergy related issues. His dedication to providing advanced, compassionate care makes him one of the most trusted specialists in the region. It's such a pleasure to have you with us today. A very warm welcome to you, Dr. Rahul Gulaganji.
Thank you for your kind words and thoughtful description about me. Before beginning the session, today's session is
Yes.
on allergies and its prevention. So, allergies today affect millions of children and adults as well, and most parents still have the doubt why allergens happen, whether they are hereditary, whether children can outgrow them, what foods to introduce them to prevent from allergens, and also what precautions they can take to prevent allergies.
Right. Thus, it becomes very important to talk about it and spread awareness about allergies and what, as parent, we can do. So, to start with, doctor, what is the prevalence of allergies?
Okay, prevalence globally, the prevalence of allergies is around 20 to 30%, and in some children, the numbers are even higher, between 30 to 40%. Allergies include sneezing allergy, asthma, skin allergy, and food allergies as well. But here is something interesting I want to say. The prevalence also depends on the urban cities as well as rural cities. In urban cities, because of the higher population, more indoor lifestyle, and air conditioned spaces, and also less exposure to natural microbes. So, kids in urban population have higher rates of asthma, rhinitis, and eczema. Whereas in compared to rural areas, children they go outside to play games and interact with soil, animals, and natural microbes. So their immune system learns to tolerate allergens better. In fact, studies in rural cities show that 40 to 60% of the prevalence. So I can say allergies are very common today, and the numbers are really increasing.
Right. So numbers of allergy patients are continuously increasing, and thus it becomes even more important to talk about it, as we, initially spoke about it, and important to spread awareness. Doctor, has the prevalence of allergy increased over period of time? And if yes, what are the probable reasons you think about it?
Absolutely, the prevalence of allergy has increased over the time dramatically. I can say from the past, at least from 20 to 30 years. It is because maybe because of the hygiene hypothesis. Children today, what happens? They grow in extremely clean environment. While this sounds good, but that means the immune system has less training in their early life, which becomes hyperactive in the later life. Also, because of the pollution, traffic gases, and indoor air pollution, this all irritates the upper respiratory tract as well as your lower respiratory tract. And then also the food patterns have changed actually. There are more of processed foods and less fresh fruits and vegetables, which carries low fiber, which leads to the poor gut health and leads to more of the allergies. Also, you can say people are using excessive antibiotic these days. What happens? They destroy the normal beneficial gut bacteria which maintain the immune balance. So compared, like seeing all this, definitely there is a increased prevalence over the period of time.
Right. So these are the common reasons why the prevalence of allergy has increased over a period of time. Dr. Rahul, now we would like to talk about the common allergic disorders. What are the common allergic disorders, doctor?
I can tell you allergic rhinitis. First of all, we'll start with nose. Allergic rhinitis, that symptoms of allergic rhinitis are sneezing, running nose, or blocking nose. Sometimes people even come with itching in the nose and the throat, which worsens in the morning or during the dusty places. Also, when we go for lower respiratory tract, that is asthma, the symptoms of asthma are cough, wheezing, chest tightness, and breathlessness. People with come with also skin infections, eczema, with dry, itchy and red skin on the cheeks, arms and behind the knees, mostly in the kids. Food allergies causes, they lead to vomiting, hives, swelling and severe reaction like anaphylaxis. Urticaria lead to the red raised itchy patches. Then there are some drugs which also cause allergies like penicillins, NSAIDs, amoxicillin, and also these days I'm seeing insect sting allergy also. So these can overlap. For example, I can say a child with eczema often later develop allergic rhinitis or asthma. This we call as an allergic march.
Okay. Right. Doctor, how serious are allergies? I mean, can it be life threatening at any point of time?
Yeah, they are going to be life threatening. Sometimes people, they just land up in our casualty with complete swelling, itching over their body, and they may just we cannot even save them when they come after some point of time. There's something called golden hour, golden time. If they come within that golden time, then we can give them adrenaline, we can give them avil injection, and we can save them. But it can be life threatening condition.
Okay. Now, doctor, talking about the allergens, what are the most common allergens?
I can say allergens are very simple substances that are harmless to the most of the people, but trigger reactions in some time. For example, I can say airborne allergens, like in natural airborne allergens. There's dust mite, which is most common in the indoor, pollen, trees, grass, flowers, animal hair, like the animal pet, maybe cats and dogs, their hair, mold, cockroach allergens. And now next moving to the food allergens. People are allergic to cow milk, egg, soya beans, shellfish, wheat, peanuts. And other allergens include the medicine, insect venom. Even some people, I can tell you, some people are very much allergic to fragrances of the perfumes. And some people are allergic to the hair dyes as well, which they won't be even knowing that they're allergic to hair dyes. So when they apply the hair dye, they develop allergic reaction all over their body, and then they come to us.
Right. Doctor, we as laymen, whenever we talk about allergies, we often say that some allergies causes itching, some allergy may cause swelling of various parts. You also mentioned it in previous one of the previous answers. So, what are the various classification as a layman to understand that this could be, out of some kind of allergy?
So for a layman person, we can tell allergy is something which is not suitable for them. Allergy is something which causes itching to them, maybe blocking nose sensation, running nose, which is irritant to them. So when they feel that they're irritant with one substance, maybe after they exposed to that one substance, they should think that they are allergic to that. So, for example, I can tell you some people are allergic to even sunflower fragrance or red flower, rose fragrance. So they should know that, and they should avoid such things which they are allergic to. They should avoid it.
Right. Doctor, many a times, we have seen again in layman that there are people who know that they are allergic to something. They are allergic to maybe eating egg or seafood or to pollens or whatever. And then there are people who are normal, who are okay with anything, and suddenly they have started, realizing that whenever they are either exposed to pollens or maybe eating something and they are causing allergy suddenly, which was not there before. Would you like to shed some more light over that?
Yeah, definitely. When before, for example, like you mentioned about food allergens, some people
Yes.
are allergic to small peanuts as well. So they will
Right.
develop allergic reaction right immediately after even eating one small peanut. So they will develop redness, itching all over from head to toe. I can say from head to toe, and it is so severe that they cannot even like sit at one place. They'll be itching their body
Mm,
all over, and immediately that veil develops and redness. So then that immediately they come to us. Then we start asking about the history, what has happened after taking what instance this has developed and how it has developed over how much period of time. So we take proper history and evaluate them by examining physical examination, and then we come to conclusion that okay, they are allergic to some of the food items.
mm. Right. Many times we often say or have seen people saying that we all know there is a big urban rural divide in our society, in our country. We often say that allergies is something which mostly, posh people or people who are living in urban societies, they get allergies. People who are living in rural societies, who are really very grounded, down to earth, connected with the nature more, they have lesser allergies. This is a very common perspective that people have. I want to know, doctor, is it really so, or it's just a perception people often,
It is. It
discuss
is.
about?
No, no. It is really different from urban to rural population. I'll tell you why. Because what happens in urban population is we are kids in urban population, they are not much exposed to outdoor games these days. They are in their I can say like tab or ipad, they're playing their own games like from
Right.
the past few years at least. But what happens in rural area, they go outside, they exposed to the sunlight, they actually play in the mud soil. What happens at that point of time, they are exposed to some kind of allergens which develops immunity in them. Okay, but in urban population this is less developed, there is no immunity. So what happens, immediately quick one allergen, they'll get into anaphylactic shock and they'll end up in the hospital.
Oh, right. So, keeping us more closer to the nature can help us in many ways, of course, and with allergies also, it can be very helpful. Now, a very related question, another question to what you just answered, is allergy related to immunity, doctor?
Yes, allergies are 100% related to the immunity. I'll tell you in simple words how it is related to the immunity. Immune system, like our immune system, it's a harmless substance. Like whenever it's exposed to the harmless substance, it produces IgE antibodies against it. And
Hmm.
repeatedly exposing to the same harmless substances, those IgE antibodies, they go and attack on the mast cells. Okay, so when
Okay.
exposed to the same allergen, these
Hmm.
mast cells, they burst out. They burst out and they release histamine, which results in itching, redness, swelling, sneezing, wheezing, chest tightness. Yes. So an allergy does not mean the immune system is weak, but it means that the immune system is overreacting for that allergen.
Hmm. A very common practice we Indians, go for is to go for over the counter medicines. In case of allergy, most of the time people will go to a nearby chemist shop, ask for any anti-allergent, and they'll have it for a couple of days, and they'll be fine. As a doctor, Dr. Rahul Gulaganji, I'd like you to tell us, is this the right approach, or what should be the way to go for it for, at least understanding why we are having that particular allergy?
Definitely, this is not a good practice, to be very frank. They should not
Yes.
approach a chemist or any medicine person and directly get the medicines from them, because the chemist knows only one medication to be given for all type of allergens. Understood? They
Right.
don't know which medicine to be given for which kind of allergen and how to treat different type of allergies. For
Hmm.
example, I can tell you, patient coming with running nose or blocking nose, they'll just give one small antihistamine or some antibiotic. They'll just give them some. But we, as a doctor, we evaluate them. We evaluate them from head to toe, asking
Hmm.
their history, where it started, how did it start, when was the first episode, when was the recent episode, and then we examine them and then we come to conclusion, and then we decide that okay, this is the right medication for this kind of allergy, and then we treat accordingly. Also, we do some investigations. We send IgE, we send IgE and serum IgE. Sometimes we even get a patient having asthma chest, and we get chest X-ray done. So we get investigations done, and then we come to conclusion. But as a chemist, he will just give one medicine. This practice has to be stopped.
Right. A similar question was asked by one of our viewers, Satvik Shrivastava, that does taking medicine from pharmacy help. Satvik, now you know the answer. Please go to a doctor because they'll tell you, at least they'll help you finding out what is, triggering the allergy. It's very important to understand why it's taking place, why it's happening. Another very common thing that we often do, doctor, is to, for example, if I'm allergic to something and I have been
Mhm.
told to avoid that particular trigger, I'll
Okay.
spread a word that say egg, because many a
Okay.
times people are allergic. I'll tell
Mhm.
the tell everybody, whomever I meet, probably, that stop eating egg because egg will lead to egg is something which is very potent of leading to allergies. This is again a very common practice. We make umbrella list that okay, we won't have seafood, we won't have this, we won't have that. But the
Mhm.
thing is that everything under the sun and even sun can cause allergies, so we can't actually
True.
ignore everything.
Hmm.
So what is your take on that, doctor? I'm sure you also get patients who said that I've never eaten this or I've never done this because I know that this will lead to
The
allergy.
best example I can tell is me only. I'm allergic to seafood. I don't eat seafood
Okay.
though,
uh,
because I have had seafood almost 10, 12 years ago. Then I had severe allergic reactions. Best
hmm,
example is me only. I don't let me not include patient in this. I'll tell you about my own personal example here. So
right.
after eating seafood, like within hours, I developed rashes all over my body. Then I understood, okay. Then I had the seafood for second time also, thinking that okay, this must be some very minor thing, whatever has happened. Then again, it repeated. It got
Hmm.
repeated for the second time as well. Then I consulted somebody. Then they told, okay, I'm allergic to seafood. They also even till today, I don't eat seafood. So
Right.
I thought I cannot spread a false message saying that okay, people
Right.
just stop eating seafood.
uh,
So people, my immunity is different. My immune system is different than others. So people, as an individual, we are allergic to different of allergens, like allergic to different allergens. So let's not spread about it. That let's stop eating egg or seafood or fish. So it depends on
right.
individual actually.
Absolutely. Another thing that we have started followed in case of allergies is to go for these allergy tests without even consulting a doctor, because they are so easy. I mean, people know about it, we have the information, and when we come out with the reports from the path lab, we realize that we are maybe allergic to 20 odd things. But
Yeah, yeah.
again, the practical thing is that we can't omit those 20 things from our life. So, what's your take? Is it a good idea to go for these tests without consulting a doctor, or should we go for it only when the doctor asks us to go for it?
No, we have to do those skin prick tests. Like for at a time, there are 50 allergens we can test. Okay, for
Hmm.
example, pollens, trees, cat, dogs. Okay, at a time we can test about for 50 skin allergics. So when after doing that test, we'll small skin prick test, waiting for 15 to 20 minutes. They develop we inflamed skin around it. So that's when we tell them. So actually, you are allergic to this and this as well. Even sometimes patient they themselves, they won't be even knowing only that what they're allergic to, just randomly
Right.
bump into us and say I developed this all of a sudden. And when we ask them, when after asking history, they tell we don't know how it developed, how it has happened. I'm fine, I take care of my health. I take I take bath twice daily. I'm still suffering from this, I don't know why. I take care of myself. So we have to do those some skin prick test as well as serum IgE test. Only
Right.
after evaluating them properly as a physician or a surgeon or a doctor, they will tell them what they have to avoid it.
True. Okay. The doctor, is allergy related to our gut health as well?
Yes, yes, gut health has massive impact on allergies. What happens? The gut or gut has got trillions of bacteria that regulate immune tolerance. When the gut microbe is healthy, immune is balanced. But when it gets disturbed, our immunity becomes hyperactive. What happens to our gut health? I'll tell you. Early or frequent antibiotics or poor diet, low fiber food. Sometimes I can tell you even C-section delivery, formula feeding, pollution,
Mm,
stress. So what
mm.
improves this gut health is like breastfeeding, fiber-rich food, having curd or yogurt, probiotic, taking probiotics, fermented fruits, and fresh vegetables and fruits. A healthy gut that reduces eczema, asthma, and also the food allergy risk. That's why I tell you that gut health is certain in allergy prevention.
Absolutely. So, gut health is very important. Now, doctor, family history, do they have any role in allergy? Are allergic disorders hereditary?
Definitely. Allergic disorders are very strongly into genetics. Very, very strongly. And if one parent has allergies, there are chances of 30 to 40% that child will also develop the same kind of allergy. Like even just one parent. If both parents are having allergies, then there is chances of 60 to 70% of that child developing the same allergy. What happens, this tendency to develop allergies, it is called as atopy. But to remember, genes are not destiny, they just give us susceptibility. So what happens, environment decides our expression. Definitely if one parent or both the parents are having even mild kind of allergies, there are very high chances that even child will also get the same allergy.
Anything that we can do, doctor, in this case, as a parent, that our parent do not, our child do not get these allergies? Anything, even as when we are planning the family, we can do?
Yeah, definitely. Why not? There are a few immunotherapy medications which they have to take first, and they have to get rid of it. What happens
Okay.
when the parents are still suffering from few allergies? They cannot expect that their child shouldn't be suffering from anything. First of all, they should get rid of that allergy, and then they should go for it. There is
Right.
immunotherapy. There are steroid nasal spray. There are steroid injections also available. So, and this is a long term, it's not a short term. Like I cannot tell you that I'll cure your allergy in like 10 days or 15 days. It takes
Right.
months, it takes months or years sometimes to cure that allergy.
Okay, right. Now, doctor, which system in the body are commonly affected with allergy?
Allergies actually affect the multiple system. For example, upper respiratory tract and the lower respiratory tract system. Upper respiratory tract coming to the nose. Patients, they do come with us rhinitis, sneezing, blocking nose, sometimes sinusitis, and lower respiratory tract infection. They come with cough and chest tightness, chest pain, also asthma condition. Also it affects skin. They do develop hives or eczema.
Mhm.
Even eyes also, I'll tell you, they do come with watering of the eyes. We just feel that sometimes people who are layman, they think that they're crying, they're really crying, or sometimes we tell that they're having crocodile tears, but it is allergic conjunctivitis. Okay, even
Okay.
eyes can also affect from the allergies. And our gut health, gastrointestinal, they do come with vomiting, diarrhea, abdominal pain after taking that one particular type of allergies. Actually, it's a whole body thing, like the whole from head to toe. It's an anaphylactic
Mm,
reaction. It's a medical emergency. It is not
mm.
limited to like one or two parts of the body. It is like complete body evaluation has to be done.
Okay. As we know, doctor, many a times we get to know what is the trigger, what is causing the allergy in a particular individual. Are there also cases when the exact cause is not known? And if there is, such cases are there, then how do you treat? How do you go for it?
More than 50% of the cases there is an unknown history, unknown allergen. So when they visit us, when they come to our OPD, we evaluate them like taking history, and then we go for skin prick test, as I told you earlier also. At least we
Yes.
can test for 50 allergens at one point of time. Okay, on
Hmm.
our hand, only on our hand. So we inject into the skin the allergen. We inject the allergen and we wait for at least 15 to 20 minutes to see anything like wheal or inflamed skin or rashes developed around that. and then we get to know that okay, this person is allergic to this. Even patients also sometimes they'll be shocked to hear what they're allergic to. They'll be living with that allergy or allergen from many years, and they'll be shocked to hear okay, you are allergic to something. So this happened many times.
Okay. Doctor, does the severity of allergy increase with age?
uh, no, no, not always. Sometimes the severity reduces also. I can tell you that mild eczema, it improves with age. Sometimes even the
Okay.
cow milk and the egg allergy often disappear in adulthood. Some dust allergies also improve. Sometimes the severity increases also, like untreated asthma can worsen. Asthma, they'll be patients will be having asthma, but they won't be consulting a proper physician. As you said, they go to chemist, they'll get some medications, they'll be fine for a few days. Again, after like 15 days, again they develop same thing. They go to the chemist. So this it's a cycle. So untreated asthma can even worsen. Dust mite
Oh,
allergy often persists, and chronic rhinitis, rhinosinusitis may progress, and we have to do surgery on them. So severity doesn't actually increase with the age, but it depends on the lifestyle, environment, and the early treatment.
so if a child develops allergy at young age, does he outgrow the allergy with time?
Oh, yes, many children do actually. Commonly, this outgrown is before the age of 5 to 7. For example, for milk allergy, egg, soya bean, wheat allergy, and mild eczema. But less commonly outgrown are peanuts and fish, shellfish, dust mite allergy, asthma. It depends. So some allergies are temporary and some allergies are lifelong. So better the early management increase the chances of outgrowing.
So are allergic disorders permanent, doctor?
Yeah, they can be permanent. They can be permanent, but not always. Allergies can decrease. They become mild. Allergies, patients are having allergies, but they become from severe to mild because they
Right.
are taking treatment. It persists and may become severe when they stop the treatment, and also
Right.
stay for lifelong. It depends on their genetics, exposure to the environment, as well as early treatment and prevention.
Right. As Dr. Rahul Gulaganji, you have mentioned in number of times that, if you go for the right, approach, if you go to the right person, the specialist, the doctor, then of course you'll have a better management. Now, in connection with that, though we have talked about it in bits and pieces, doctor, when a person with allergy comes to you, what are the basics that you ask them to do? What are the tests? Though we have talked about it a bit, but we would like you to shed some more light over how you do the diagnosis.
So, patients usually come to us in ENT department with rhinitis and recurrent sneezing, blocking sensation of the nose. We first do examination, like physical examination. We see if there are any nasal polyposis are there. Okay, that we have to evaluate. There is polyposis, nasal polyposis. Definitely, we have to think about nasal polyposis. Like there are two types of polyposis, that is ethmoid polyposis and antraconal polyposis. Okay, so if there are no polyps in the nose, then we tell them to get a serum IgE done. Serum IgE. So in reportedly in many patients, the serum IgE level will be more than people who are having allergy is more than 500, sometimes even more than 1000. Okay, so patients, if they're having rhinitis, rhinosinusitis, we tell them to get a CT scan done, CT scan of the paranasal sinuses. So we'll see which sinuses are involved. There are either maxillary sinus or ethmoid, anterethmoid or posterior ethmoid sinus, sometimes frontal sinus and sphenoid sinus. We tell them to get a CT scan done, and then we see which sinuses are involved, and then we evaluate. And then if after doing everything, then we go for skin prick test as well. Skin prick test, I
Okay.
told you earlier how they do as well.
Yes. Right. And doctor, what are the treatment options available for treating allergies?
Treatment for rhinitis, we can give steroid nasal spray, that is fluticasone furoate and mometazone furoate. Okay, this has to be taken for a longer period of time. Like we have to give them not for like 1 week or 10 days, 15 days. at least for a month period, and we had to give them antihistamine. Okay, antihistamine for like belastine, levocetirizine, montelukast. So we have to give them antihistamines, and the main treatment comes is immunotherapy. Immunotherapy that has to be taken for like 6 months. 6 months, not even living for like without any gap for not even 1 week. That would continue that treatment for 6 months.
Okay, right. Doctor, I think the most important question is that what are the precautions or measures to be taken by parents to help child grow up allergy free?
It actually starts from the time when the mother is pregnant. Okay, during pregnancy, the mother has to have a healthy diet and avoid unnecessary antibiotic by taking vitamin D, calciums, everything. And also, the main thing I can tell you that they should avoid smoking. Okay, mothers
Okay.
who are carrying, and for
Hmm.
infants, exclusive breastfeeding for 6 months and avoid delaying of the solid foods. Also,
Hmm.
introduce allergens early, like give peanut, give egg around 6 months under the guidance, so that they
Hmm.
will at least in early period of time you'll know what is your child allergic to. Give them all types
Right.
of food and then see whether they
Right.
are fine or they're not fine
Right.
for infants.
Oh,
And coming to the environment, we should reduce the dust mites and also wash our bedding, our bedding weekly once, and sun dried mattresses. Keep our room ventilated. Cross ventilation should be there in our room. Okay,
hmm.
and many people they do indoor smoking. They should avoid indoor smoking, and
Okay.
very minimal carpets with heavy curtains at home covering their windows. And
Hmm.
for children, like for kids, keep your toys clean, soft toys clean. Okay,
Right.
and by taking high fiber food, like for example curd, yogurt, more of like green vegetables, and also less junk food, less sugar, and less packaged food. By doing all this we can still avoid many allergens. And coming to the
Great.
last lifestyle thing, I
Hmm.
suggest, I tell all the parents to send their kids outside to play. Like, please send them,
Yes.
tell them how to play outside. Outdoor games are very important, at least 1 to 2 hours in a day. Exposure to the
Okay.
sun and maintain
Yeah.
healthy weight. This is by
Okay.
doing all this, we can prevent it.
Fair enough. I'll quickly take few of the questions by our viewers. Gitika is asking, can allergies affect sleep, learning, or school performance?
Very, very good question, actually. Allergies definitely affect sleep. For in a school going child, I can tell you, if they don't
Yeah.
sleep at night, they can't concentrate in the school during the daytime. They cannot they cannot follow whatever the teacher is teaching. Definitely that reduces their academic results. Okay,
Hmm.
and and then academic results are down, not for like for 1 year, it continues frequently. And when they come at later stages and then they feel that okay, people are allergic to this, then the parents feel that okay, we should have identified this at an early age, so that
Right.
their son or daughter would have scored better or had a better academics in their school. So it does affect school performance also.
Okay, one more question that I'm going to take is by Chandrani. Question is, do seasonal allergies require different care at different ages?
No, there's nothing like, definitely there are seasonal allergies and perennial allergies, but they don't require different care. Sometimes people are allergic throughout the year. Okay, seasonal allergies means like this month, like November, December, because of the winter. Many people
Hmm.
we just see that they come with running nose, blocking sensation in the nose, recurrent sneezing, and complete what I can say, watering of the eyes. This is called only seasonal.
Okay.
But there is no different treatment strategy for seasonal allergies or perennial allergy, and also the treatment is same for all the ages.
Okay. Now, Dr. Rahul Gulaganji, any closing remark, any take home message, doctor, for our viewers?
I can tell. Allergies these days are becoming very common. Okay, but with the right knowledge, they can be prevented, controlled, and sometimes it can be reversed also. So better to consult a proper physician, surgeon whenever you develop allergic reactions, and take proper treatment, and you will get rid of it by taking a long term treatment.
Definitely. Thank you so very much, Dr. Rahul Gulaganji, for your valuable time. It has been a very informative session for our viewers. Your insights on long term allergy management will surely help many parents handle their children's health with more confidence and clarity. We truly look forward, sir, to many more such sessions in the coming times with you. Thank you.
Thank you. Thank you. Thank you so much.
Thank you, viewers, for your excellent participation. This was issued in public interest by the makers of Lulibo Lotion Advanced Genex division of Hetero Healthcare. Thank you, viewers, for joining today's session. Stay connected to our channel and don't forget to subscribe to Radiance with You. Thank you and have a great evening ahead. Goodbye.